Thanks to everybody for coming. If you're watching this, you can always feel free to reach out in the comments below, or you can email me, drcobb, Dr. Cobb at blairclinic.com. Find me on Instagram as well. Today we're going to be talking about concussions, MTBIs, which is mild traumatic brain injuries, and we're also going to be talking about post-concussion syndrome, preventative strategies, and also the rehab strategies, because a lot of times concussion care is kind of one of those misnomers where not many people know much about it, and not many people understand how to take care of it. And so a lot of people end up having concussion symptoms for years after the fact and ultimately don't get the education or the information or the rehab that they actually need. So that's why it's important to have a team. But today we're going to be talking about defining concussions, understanding what, how, and why concussions happen, diagnosing concussions or recognizing them, recognizing the symptoms and the red flags. Concussion rehab, just the basics of full body concussion rehab, because concussions are not just a brain injury, they affect the entire body. And then some prevention strategies, some things that you can do, whether you're an athlete or a parent of an athlete, to take care of that before it can happen. My overall goal is to inform, not to scare. I don't want you to walk away from this and be like, I am horrified to play sports. So I want you to understand that there are things you can do beforehand, but also there's some things that you can do to make some really informed decisions on care. So a lot of people ask me, am I going to let my kids play sports or football? Because I played football growing up and I played in college as well. A lot of people ask me and I'm like, yeah, totally. If they want to play and they can, absolutely. I'd love for them to. But we're going to be able to get ahead of some things and also understand how to rehab for some things as well. A little bit about me. So I got my bachelor's of biology from the Virginia Military Institute, played football there, had at least one diagnosed concussion, but how often did I have concussions? How many more did I have? Who knows? I fell in love with the Blair chiropractic technique when I was in chiropractic school, which is an upper cervical technique, dealing mainly with head and neck injuries. And I fell in love with it mainly because I had a concussion that really took me out of life. I had a concussion, had a panic attack, and a slew of mental health issues and body health issues after that. And so I'm passionate about it because I get to help people there too. A lot of what you're going to see today is from the Complete Concussion Management Institute, which is a chiropractor who has put together a full, well-rounded rehab protocol and education on the concussion side of things. So I took their course, 60 hours or so of continuing ed, and loved it. But really, my main thing that I love to do is see people become fully alive so they can live out their calling and passions in life. We all want to do things. We all have things that we are called to do and passionate to do. Sometimes life gets in the way, health gets in the way, but I want to take that hindrance out as much as possible. So the biggest reason why I care about concussions is what I talked about a minute ago. I had a panic attack about a week after taking a soccer ball to the head, which I didn't think was a concussion. I got up and I was like, I shook it off. The biggest thing that I think is going on is that people are being affected negatively. Their lives are affected because they just don't know. I had a conversation with a mom and dad recently whose son had a concussion, and he had a severe headache and had all kinds of symptoms. And so they went to the ER, and the biggest thing they told him was like, just, rest until all the symptoms go away, which is horrible advice nowadays. But I'm glad they went to the ER just to get everything checked, but they just didn't know. The biggest thing that she had going on was, I just really have no idea what to do about this. And I got to educate. This is where I really care, though, because I had plenty of hits like that. It's actually me, by the way. I found it somewhere. I don't know what it was. I don't have like a highlight reel, but I was horrible at sliding. And we've also all seen it in the news, right? This was Tua a couple years ago. This was on a Thursday night. Like to see the fingers going. When we see things like that, that means that the brain has completely been shut off of oxygen, especially the brainstem. Everything starts to flex and extend, and you just lock up like you're having a big seizure. But really, what's really important is this was just several days prior. This was the Sunday before that Thursday night. How did he get back on the field? I have no idea how he got back on the field. You can't even pass a protocol in the NFL within 5 days. You have to have at least 6 days. He should not have been on the field. It's horrible management. But also, there's more, right? This was Tua the next year. Took a hit, see that same flexion position. I honestly don't know how Tua is still on the field. But we see those same things. There were more, there's a lot of concussions that happen every single year. We're going to learn a bit more about that. Stat-wise, so when you think about overall concussions, sports or recreation-related concussions, usually in kids, young adults, about 1.5 to 3.5 million per year. That's from the CDC. And about 1.15% of the general population estimated to sustain a concussion every year. And that's thousands here in Lubbock. If you think about it, I think the math was at like 3,000 a year here in Lubbock, just based off of our population. 10% of all contact sports athletes every single year. But what's really important for me, and this is where I really come into this picture, is 20 to 30% of these symptoms. When you think about concussion symptoms, typically headaches, dizziness, lack of motivation, fatigue, lighter sound sensitivity, digestive issues, mental issues. Those usually go away within the first week or two. But for a decent amount, 20 to 30%, more research being done is showing about 30% more than 20%. But about 30%, a third of people have symptoms that go past that 12, 14-day mark. And that's when we start calling them post-concussion syndrome. So there's about 20 to 30% of those people. And that's a good thing because 80 to 70% of people don't have symptoms. Their brain just kind of heals on its own. But what about those people who don't? When we think about a concussion, this is the medical definition of it. It's a complex pathophysiological process affecting the brain induced by traumatic biomechanical forces that may be caused by a direct blow to the head, face, neck, or elsewhere in the body with an impulsive force transmitted to the head. That's the concussion in sport group. What does that really mean? It means it's just a functional injury. So that's something that happens to you when you're playing or whatever you might be doing, you fall, car accidents. It's caused by a trauma anywhere into the body. So that could be, you could take a blow to the legs and it jolts your head and neck around to an extent where the brain is affected. It transmits it to the head or neck. This sets off a neuroinflammatory cascade, which for me, that means that the brain, that's what neuro means. There's like a fire going on in the brain. For good reason, it needs to heal. And inflammation is a means to heal. But what happens when it goes longer, we'll talk about today. And it affects multiple functional organ systems. So it's not just a brain injury. It's not just a head injury. It's not just a neck injury. It affects a lot of different systems. It's important to keep that in mind. So, well, anybody know what that is? Not you. Yeah, it's a nerve. Yeah, it's a neuron. It's what we call it. It's a cell. It's the functional unit, the smallest unit of the nervous system. It's what we call a neuron. So you've got the cell body here. This is like the head of it. And this is like the tail. We call these little dendrites. They're like little fingers. And then along here, this is where signals go from the body down the spine, which is funny, down the spine of the cell. And then stuff comes out the end to transmit signals. The way that it does that is it has these little molecules which just send information and they go in and out of the cell. And this is what happens in a concussion. As they travel down, they should have a normal variation. There shouldn't be too much because this is a very sensitive balance. But what happens when we have a concussion, which this is probably my favorite picture of what happens with the concussion. A lot of people have thought for years that a concussion is like a brain bruise where the brain just slaps up against the wall, but the brain is usually sitting in this great amount of fluid in the skull, and it's protected by the skull. So it's probably less common that there's going to be, in the concussion sense, a part of the brain that just slaps up against the skull. At that point, we'd usually call it, if there's a bruise there or if there's some type of swelling, that moves it into more of the moderate to severe traumatic brain injury. So we're not even really dealing with a true concussion at that point. We're talking about really severe brain injury. But what we know now is that there's something called, this is called an axon, that spine of the neuron there. It's like an axon injury. So it almost shears and tears that axon, and it messes up with this perfect balance of the transmitters there that send information. So we see that, it messes with that, and now we've got this imbalance of perfect messaging, and it really destroys the cell. It's really detrimental to the cell. So we talk about concussions happening almost on this timeline. Can you see the bottom? Where this is, anybody know what this is? We're doing a lot of anatomy here. Yeah, it's a mitochondria. It's the powerhouse of the cell, right? It's the power system. But then also we plot it over time. So you get that initial concussion, and this is going to be on average in adult populations. You get this initial concentration or initial concussion, and you have this blast of energy. So it almost tricks the brain into thinking like, we have a lot of energy we need to use this energy really quickly. So that's what the concussion is. You get that initial shearing, that force into the brain and spinal cord, and you see a ton of energy. It just tricks the brain into using up all of its energy. So you see this initial excitatory phase. It's really excited and it uses up a lot of the energy. So it just goes up there, but then it drops. So it's used all the energy it can, and this usually happens within the first 24 to 48 hours. And then that first little bit of several days is what we call spreading depression, because it doesn't have as much energy. You used up all the energy it definitely can. That's why people that have a concussion within the first day or two, they just sleep a lot. They're really groggy. You might have brain fog. You might feel really irritated, just like anybody does when they don't have a lot of energy. And then usually at about 3 to 5 days, it hits its lower limit. After that, we see a slow climb back up to normal levels of energy and nutrition and nutrients there. And then it'll go back to its normal state. This is what we typically see in most people on average. The hard thing is, and this is where it's important to talk about the tracking of these symptoms and the concussion rehab and return to play protocols. We also see that about 5 to 7 days, 5 to 10 days, that red line is where symptoms go away. But are we at a functional level in the brain where we feel safe to go back to play yet? Usually, definitely not. We see symptoms go away, we see aggravation go away, but also we're not at the point where we typically see people able to go back to play. Now, as a disclaimer, there are definitely situations where people are fine to go back to play. I won't just be the person and be like, you have to be out for a month, you know? And that's also an individual basis. That's what makes it tricky with return to play and with rehab protocols. It's kind of up in the air for a lot of people. We don't really have a great way of testing exactly what's going on in the person. Because I remember when I was in college, I would flunk the initial test just so I wouldn't get flagged to go back to play. Everybody did that. It's just something you did, which is what I would call the culture in sport that we always fight against. So complete metabolic recovery or complete energy recovery in the brain and the body and balance of the brain and the body usually takes 2, 3, 4 weeks. 22 to 30 days on average in some adults. So it can take up to that point. Not everybody is like that, but it can take up to that point. And it not only does that, it affects different systems in the body. So different body systems are affected. The autonomic nervous system, which is the automatic processes of the body controlled by this part of the brain called the brainstem, which sits right above the base of the skull. It's one of the first things that you encounter from the spinal cord. So we see the autonomic nervous system. That's the breathing, the automatic breathing, heart rate, digestion. A lot of people will have this thing called dysautonomia, which is just a dysfunction in the autonomic nervous system. Very common after concussions. Also very common after infections and stuff, if the body is just for some reason not getting back online. And it's important to keep this in mind because people will go into circles after concussion care or after a concussion when they're having autonomic problems, but maybe you go to the doctor and they're like, wow, I just don't see anything wrong. You're just give it more time, or maybe it's all in your head. A lot of people hear that. Inflammation, this is just overall inflammation of the body. This would be gut inflammation. This can include hormonal changes after a concussion. When we talk about the visual system or the vestibular system, this is where obviously the visual system is vision, light sensitivity, blurriness, a felt sense of brain fog, but also the balance centers of the brain. That's the vestibular system, including the inner ear and the cerebellum, some of those areas in the brain that are really important for knowing where you are in space, knowing what movement is doing to your body. A lot of people will either feel like a lot of spinning or spinning when you turn your head real quickly. Also feeling just this general feeling of unbalance or imbalance in the body. One of my favorite, and why I prefer to do this as a upper cervical chiropractor and take care of concussions, a study came out recently by a PT in Australia that highlighted that about 85% of those people whose concussions last over 30 days, about 85% of those people have some portion of a neck injury. And it's because about 4.5 pounds of force is needed to cause an injury in the neck, whether the joints or the ligaments or the muscles, but about 70 pounds of force is needed to cause a concussion. So you can see that imbalance there. So it takes about 20 times less the amount of force needed to cause a concussion than it is to cause a neck injury. So we can pretty much assume that there's a neck injury if you have a concussion. The last one is psychological. A lot of people just skip over this or choose not to take care of it or think through it. There's a psychological component, and I definitely felt that. When you think about how the inflammation can affect the gut and the hormones, that alone can have you experience some of those psychological issues as well. Whether it's depression or anxiety. In my own life, I had that. The psychological component for me was I had that concussion, and I think what's interesting about the psychological and gut and hormones, within about 2 hours, 24 hours after that concussion, the initial blow, there is an immediate release and change in the gut lining, something that we would call leaky gut. Researchers have seen that after that initial blow, the body goes into this response mode where it needs to really be good at exchanging fluids into and out of the body and getting that inflammation out. So what it does, for a good reason, is open up the lining of the gut, what we call leaky gut. And a lot of people will experience digestive issues or the neurotransmitter issues like serotonin and dopamine, which are primarily created in the gut and transferred to the brain. So there's that weird gut-brain connection there that's causing issues directly after a concussion. So it's important to take that into account, not necessarily that I treat that, but also keep that in my mind as well when it comes to just recommending probiotics or eating well as part of that. And it gives people some hope that they're like, I just got crazy out of nowhere. It's like, no, you had a brain injury that caused this whole body cascade. The last important thing to talk about is something that we call second impact syndrome. So we have a concussion here. We do our 3 to 5 day protocols. Within 5 to 10 days, maybe we feel okay, maybe we don't, maybe we rush it. Something that's really important, if I plot this concussion here, before we get all the way back up to a stable level of health and brain health, what we can see is if we have another concussion there, it pushes us down below this line. And I call this line the cell death line, because at this point, this is where cells are actually being affected in the brain. So if you have with second impact syndrome, the symptoms go away, but you're not completely rehabbed to the exact level that you need to be, you're already still susceptible to another injury. It will take significantly less force to create another concussion. So you're already risking it. You get hit again, and now it really, really affects you. You're going to need really intense protocols, really intense help and care. And what is really important is that the recovery will take even longer at this point. So maybe what would have taken another 5 days now is going to take maybe a month. Who knows? So it's important to also talk about that this is not everybody. It's completely possible that people can be back on the field a week later, or be back doing what they love and doing what they need to do a week later, be back at work. But each individual is different. Each injury is different. Each concussion is different. So it's important to have somebody specialized to take a look at this. One of the biggest impact factors when some of the researchers did their studies were most people, the biggest indicator of whether or not they had symptoms that lasted more than 30 days, 2 months, was the amount of time between the initial injury and seeing somebody who's actually trained to do this. So if somebody had a concussion and they were in another office within a week, they had higher chances of not having to experiencing these symptoms long term. But we also see that if they waited longer and longer, which a lot of people do, and a lot of people, I'll see them years after a car accident that they've been dealing with these symptoms ever since, they'll still be dealing with them. So it's important to take that into account. When we really talk about an integrative treatment approach, what we're really trying to do is educate and inform people to pursue the appropriate strategies necessary. Oh, I better hurry up. The most important part is that watching and waiting, or just resting in a dark room for a week, is going to end up hurting people more, and it will harm them than it will benefit them. And this is what new strategies teach us based off of the research. So when we talk about acute, which is quick, early, we want to talk about dealing with immediate depletion of energy in the brain, a lot of inflammation in the brain, and possible blood flow changes, which can happen. We want to talk about red flags. If you're having bruising, something that we call battle sign, this is a bruise right behind the ear, essentially. I don't know why it always happens there, but that's where a lot of the bruising will happen. You see that, or if you notice changes in speech, slurring speech, really bad memory issues, unable to comprehend or communicate well, a lot of dizziness, neurological signs like drooping of one side of the face, you need to be in an emergency room as quickly as possible. And if I see that, I'm going to send you out. I'm going to call an ambulance for you. Rest, which can be good. We don't want to take it too far, but rest immediately. It used to be, rest until all the symptoms are gone. Now it's a day or two maximum. If you have a concussion, you should rest for a day or two to allow your body to kind of get back to where it needs to be. But then you need to be exercising a little bit. Within 24 to 48 hours, you should be performing what we call sub-symptom threshold exercises. And I always start with walking, and you should walk until you have symptoms, track that time. The next day, go back and try to walk that same amount of time, maybe push it a little bit more. Hopefully you have a little bit more availability. Then you'll get a little bit more symptoms. Maybe it's 2 or 3 minutes longer. Then you push it again the next day until you're able to walk an hour or so. And then you can expand. You could run. You can do a rowing machine. You can find some of the other exercises that you love. This is something in the office, we would do a Buffalo treadmill test, which is just a way to assess that. It'd be too much to talk about it now. Nutrition-wise, we should be eating whole foods. We shouldn't be eating a bunch of junk in that first several days after the concussion. Whole foods, fruits, vegetables, and proteins. And we should emphasize healthy proteins and fats. We shouldn't be eating like McDonald's burgers or whatever it is. Prioritize good, healthy proteins, good fats. Fish is amazing at that time. And consider eating just a little bit less. Usually people will eat or overeat or engorge. You're probably not going to be that hungry anyways after a concussion, because a lot of people will feel some nausea still. But decrease the calories for just a little bit. Supplementation, I always love, and we'll talk a little bit more about this, 3 or 4 supplements even before and after concussions. Omega-3 fatty acids, which are mainly found in foods like fish, nuts, mainly fish though. Creatine monohydrate, which is 5 grams to 10 grams a day. Really important because creatine is the main supplier of energy for those cells in the mitochondria. If you give them energy, they'll do a lot better. Magnesium, I prefer L-threonate. There are 1,000 different types of magnesium. I prefer L-threonate, mainly because it's more usable by the brain specifically. Magnesium competes with some of those areas in the cells that will protect them from dying, protect them from having too much inflammation affect them, and also get in to see, like I just talked about, a concussion specialist, or let your trainer know. Let somebody know. That's the hardest thing that we deal with in the concussion world. Being an athlete myself in the past was just actually telling somebody that, hey, I think I have a concussion, or letting somebody in on that conversation. Ultimately, your brain health is not worth the effect that it would have 5 to 10 years down the road. We're seeing that also with a lot of the ex-football athletes. They're getting older now and they're starting to say, maybe it wasn't worth it to play that extra game or to play that extra drive. Persistent rehab, so this is what we call the post-concussion world. We're mainly dealing with these complex neurological symptoms. We're not dealing with an inability to have a bunch of energy in our brain as much. We're dealing with these complex neurological symptoms. Dysautonomia, laying down and standing up makes you completely dizzy. You lose blood flow, you might pass out. That's the autonomic involvement. And then also cervical spine involvement. Remember, I said 85% of those people that are having symptoms at this point, chances are that it's a neck issue. Same thing goes. We should still be doing subsymptom threshold exercise or starting to implement that. Nutrition is the same advice. Implementation is the same advice. After about 10 days of symptoms, after that initial concussion, you should have somebody evaluating the cervical spine, the visual system, and the balance centers of the brain, the vestibular system. It's highly recommended. Especially after that 10 to 14 day period, you need somebody looking at that, because those are the main areas that are probably still lagging. And remember, regardless of time that's passed, it could be important to have the cervical spine assessed for dysfunction, which is what we do. When we talk about that, this is just a little bit of what I typically do in our office. We take a 3D x-ray and see how the cervical spine is functioning. We're able to see the specific joints of the neck that might be locked up, posture changes, and what we do is specific, it's gentle, and it's really collaborative with other people. That's me, by the way. I don't have a great spine. It's whatever. years of not knowing. Also, it's important to understand the functional assessment of the neck too. This is something that we use in our office called neck care. Neck care is a way to look at range of motion, something that we call proprioception, or understanding where your head is in space, and then also fine motor control. This was actually my testing at a conference. I was telling somebody I felt really dizzy. So some of us are archers in the room. That's a bad shot. That's a bad shot. That's a bad shot. That's a bad shot. You might kill it, but you're definitely not. You're going to be tracking it, hanging out at the campsite for a while. So I told this guy, I was like, man, I'm feeling dizzy. Let's do a neck care. They were at the conference, and this is somebody that knew how to exactly to adjust me. And then I said, and then adjust me, and then we'll do it again. So that was before I rested for like 5 minutes or something, and then did another one. And the improvement in that is just ridiculous. And it's something that we think through when we talk about how the brain is properly perceiving the environment, especially through the neck. And Dr. Heidi Hovik, again, has talked about this extensively. When we adjust the neck, we fire up these little bitty muscles that tell the brain exactly where it is in space. A lot of times after an injury like a concussion, we're starting to see that the brain kind of loses its place in the environment. That's why adjusting can help people who are dizzy, or help people feel like they're stumbling a lot or running into walls. We have a better perception of where we are in space. So it's important for that reason. But when we talk about preventative strategies for concussions, mouth guards, I broke it up mainly into primary, secondary, and tertiary systems. Tertiary is just like third or fourth down the line. Primary, we talk about mouth guards, proper tackling mechanics, exposure to contact, so practice. I get so mad when I see people not wearing mouth guards, like their mouthpiece is just like dangling on their face mask. They all have like mouthpieces dangling. It's like a piece of apparel that's just cool to wear nowadays. No, they are the primary way that we can help people not get concussions, is using a mouth guard, and also keeping your teeth, which is great. Proper tackling mechanics, not going head to head, which is something that football in general has completely started to get better at. Secondary, proper protocols and return to play. We don't want to keep having people get these concussions over and over and over, and we want to get them stronger in their body so that they can actually do better. And education. Imagine if all of our referees, our teams, our coaching staff, and our parents were able to spot some of these small signs before it got too bad. Tertiary, I wouldn't technically say these are the last things, but I would say supplementation has also been shown on the front end it's been shown to be able to get a higher likelihood of not getting a concussion as well. So if you're giving your brain energy before you get the concussion, you're going to have a greater chances, one, to not have the concussion, but have less symptoms after the fact. Same with magnesium. So creatine monohydrate, magnesium, omega-3, B vitamins. Which B vitamins, I would say beef liver is probably one of my favorite supplements to do it. You can get a ton of good information out there about beef liver. Same thing, diet, whole food, anti-inflammatory, and then timely entry to an experienced provider. But really, we need to know baseline testing. How is it before and how is it after? And get you back on the field when you're at a functional level instead of just a symptom-based level. A couple of things that have been really common in the football world, at least, are collars and caps. So you can see these caps here. A lot of people are using them a lot more. I honestly hate them. It's not helping you to get like a brain injury because, like I said, it happens on the inside. It's not like it's the brain's, it's not like it's like the skull's problem. It's the brain's problem inside. And only thing you're doing when you add this cap on is adding weight to your head. So you're adding weight to the pendulum that's going to eventually have a higher impact in whiplash injuries. So you add weight to the head and then you get hit here, you're going to have more of a whiplash, just physics. I think they're not a great option for that. Also, another thing that's gotten a lot of popularity is Q collars. Q collars are a way to compress the internal jugular veins very lightly. It's a way to back up fluid into the brain. The jury's still out on them. I think it could be something cool. Could be a really interesting part to play into the concussion story. A lot of people are using them. I don't think the research is there yet. There are people in the concussion world that love them. There are people that hate them and think they're very useless and just a lot of money for nothing. But who really knows yet? There's pretty new products that people don't know about. In theory, it's kind of promising. If you back up the fluid to the brain, you're going to have more cushion, and more cushion means less chances that there's going to be a lot of jolting around inside of the brain. So I think it could be promising. We'll continue to see the research probably change. So a game plan for recovery. We talk about rest only needing to be 48 hours, 24 to 48 hours post-concussion, and then you need to get up and start moving a little bit. Your brain needs this energy that it's going to get from movement. It also needs oxygen and it needs stimulation. So fluid into and out of the brain, using and reusing this energy and then stimulation by moving your body, it's going to only help your recovery. And then you should do that subsymptom threshold exercise. Anti-inflammation diet, which is whole foods. You can also add in the omega-3s, the magnesium, the creatine, and then the B vitamins. Proper and thorough exam, which would be the balance centers of the brain, the nerves coming off of the brain, the autonomic nervous system testing, and then also testing the other parts of the brain that can be really complicated and involved in this, and the cervical spine. And manual rehab has really been shown to help a whole lot, whether it's taking care of the spine, taking care of the brain, and I'm a little biased, but I think upper cervical care can be really helpful and a crucial piece of this recovery process. So if you have any questions, let me know, but now you know. And knowing really is half the battle. So if you need to have a little bit more information on this, I talk a lot about this in my podcast. You can look it up, the Life Unrestricted podcast. In the month of March in 25, I spoke to about 6 or 7 people on the concept of brain injury, because March is Brain Injury Awareness Month. So we talked a lot through that. You can also find me on Instagram at Lubbock Neck Doc. It's pretty simple. And I just educate and show what we do in the office to help people. So again, reach out to me if you have any questions. You can find me there on Instagram, and also you can email me